Hello everyone, I'm Zen. I'm from Society NS. Today we are with Dr. Sridhar Reddy. Hello doctor, introduce yourself.
Hello. Good evening, Zain. I'm Dr. Sridhar Reddy, consultant nephrologist at Krishna Institute of Medical Sciences, Secunderabad, that's in Telangana, India. Yeah, I've known Zain as a kid who was enthusiastic about learning about organ donation, and he wants to do something about um, awareness regarding the organ donation. Yeah. So here we go. What do you want to learn
Yeah,
about?
as the doctor had said, we today's topic for the podcast is organ donation. Firstly, before going to your field of your specialty, let's clear up what's organ donation and its impact on the lives of people. Firstly, what organs we can donate when we are alive?
Very interesting question, Zain. A lot of myths about. We will try to bust few myths about what organ donation means essentially. So when a person is alive, we make sure that we take a organ from a particular person and transplant it to the related person who requires it. And when you are alive, specifically, you will be able to donate either one kidney or a part of liver. So that's the organs that we'll be able to take from a donor whilst they are alive. Hope that answers your question.
Yeah. Then after that, what organs that can be donated after you die or we die?
Yeah, so we actually divide this donation into two types. One is uh, deceased donation after cardiac death and after brain death. So we divide this, and it's a very scientific terminology. So essentially, all the organs can be harvested there for potential donation. But then commonest ones are the eyes, the kidney. Both the kidneys are harvested in deceased donation, that is death donation after death. Earlier we used to call it as cadaver donation, but now out of sheer respect to the person who is donating it, we call it as deceased donation, that is DECEASED. That's called as deceased donation. Essentially all the organs can be taken up, but common ones include eyes, the skin, and then from top to bottom, if you go, you take liver, the lungs, a heart, the kidneys, and occasionally the limbs are also taken up for transplantation nowadays. So there's so much progress that essentially any organ can be taken up for transplantation broadly.
Could you please explain the differences between the deceased and living donor, including the advantages and disadvantages of both?
Yeah, very good. Excellent. So, when we say that living donation and deceased donation, there's a big difference. We always consider deceased donation program only if we do not have a living donation, when we don't have a living donation program. Simply because living donors, it can be chosen, the choice is better, and there is so much more control over the surgical aspects of the transplant. The timing, the quality of organ can be um, evaluated much earlier, and the outcomes in the long term, very long term, I would say, the living donation has a little advantage over deceased donation over a long period of time. But having said that, if we do not have an opportunity of living donation, then the only choice would be deceased donation, despite having a little bit of disadvantage compared to deceased donation. In deceased donation, the total amount of immunosuppression that we use is a little higher compared to what we use for a living donation. This is what would happen in at a very broad level. Although finer nuances, there are many more of them, but broadly, yes. If we do not have an option of living donation, like what would happen in a heart transplant or a lung transplant, we are not left with any other choice other than the deceased donation. Our choice for deceased donation and living donation happens for a kidney or a liver. If we do not have an option of living donation, then we opt for a deceased donation. But having said that, deceased donation also has good outcomes, despite living donation having little more advantages, because it can happen in controlled situations. Yeah.
Can you explain the process of organ donation? For example, I want to donate. How will I be able to do that?
Yeah, I can explain you the process, but if you want to, then you can't, because
Imagine I'm the city.
yeah, yeah. So basically, your age should permit. Yeah, you should be a major in Indian situation to give the consent to the donation. So in Indian situation, you would have to you have to be a major as per law of land to consent. Any consenting adult is eligible to donate their organ. To the relative, it is very easy. For altruistic donation, we should go through a process. Altruistic means you are not emotionally, I mean, if you are not related, but you are doing it out of emotional concern to the person who wants to receive it. For example, what happened to Selena Gomez? So one of her friends gave the kidney to Selena Gomez. That was there all in the news. So that is called as altruistic donation. So hope I answered your question.
Yeah. One follow up for this question. So where can I go and do like a register?
For a living donation, there is no registry. So we need to identify if there is a living related person who's awaiting a recipient surgery, like a kidney or a liver. So you meet a physician, they will have their internal committees, they go through a lot of documentation to prove that you are a living related donor. Living related donor meaning either parents can donate to their sons or daughters, or siblings can donate to each other, or their sons or daughters can donate to their parents, provided they are consenting adults. So once they go through the physicians or the treating transplant physician or a surgeon, then they put up across all the evaluation into the internal committee, and then go ahead to do the transplant. Suppose if your idea is only to donate after your unfortunate demise, or after your death, then you can just have a donor registry card voluntarily signed up. We still have to have some streamlined process for that. We have some voluntary registration programs where they can choose the donor cards and then keep it with you, but still we have some more process to be done for that. So by default, deceased donation, if someone wants to do, the family has to be involved with. Yeah. Okay.
So you're telling that if anyone wants to donate after they're dead, even though they have the card, they need this family's permission.
Yes. For now, yes. But then there are a few of the countries where their law says that by default their organs are harvested post their death if they are eligible. So they have, it's called as a opt-out program, where they have to declare that they don't want to give the organ rather than opting in. It's a opt-out program. Like in Spain, after a person's death, the hospital or the transplant teams harvest by default. It's called as a opt-out program.
Yeah. How does the transplant team address the potential psychological and emotional challenges faced by both the donor and the recipient before, during, and after this transplant?
That's very very important to know. First and foremost thing is to have a illness, to be suffering with a illness, which is severe and which needs a transplant itself is a major challenge for the family. So any person who's suffering with that, along with them, not only it's damage, it is also collateral damage. That means people around the person who's unfortunately suffering with this illness also go through a lot of psychological and emotional pressures. So to address that, we have multiple interviews with the physicians, the transplant team, and along with that, we have what is called as transplant coordinators who will help us in spending more and more time addressing their questions, their concerns, and then before going ahead with any surgery, we evaluate them thoroughly through a psychiatrist. So psychiatric clearance before the transplant of both the person who receives the donor, that's the recipient, and the person who's giving the organ, that is the donor, both will go through extensive evaluation very formally with a psychiatrist. Post donation, we have a support staff, support team, but mostly good thing about our Indian scenario is by the time they come to us, get accustomed to the hospital environment, they would have had made some friends who would have been waiting for the transplant physician or the surgeon, waiting in the outpatient area. They would have made some friends whilst they are on dialysis, for example. They would have made some friends. Their family support, that goes a long way in addressing their emotional and psychological well-being. It is mostly to do with the support group. Although formally we don't have any support group in terms of having them psychological concerns addressed, we do take care of them whenever it is essential.
Yeah, okay. So, how's life after the transplant for the transplant receiver and the donor?
Okay, we handle these two things separately. First would be the donor, because they are the ones who are doing a benevolent job, and they are the ones who are giving one of the major organ thing to a person who wants it. So we, before doing any of these testing, we go through their medical history, then clinical examination, and then their psychological assessment broadly, then go through a psychiatric consult. After that, we start doing a battery of tests, which include, depends on which organ we are taking, but then extensive testing happens to make sure that they don't have any comorbid illness, which will determine their fitness to donate. So we want to make sure that the quality of life will be as good as what they were before donating the organ. So they should be leading the same quality of life after they have donated. That is what would be our objective. So we want them to be hale, we want them to be healthy, and we want them to be like what they used to be before donation. So that is the donor aspect. After they have done that, and after that, once a year or once in 6 months, we always follow them up, do some tests again to make sure their overall well-being is still well within the acceptable limits. So that hopefully answers the donor's um, a person's life after donation. For the recipient, um, once again we go through the same process. What would be the what is that?
This recipient, life after.
Life after, yeah. So the life after recipient would be, we program that into pre-transplant evaluation, transplant evaluation, immediate post-transplant, short-term and long-term. So these are the stages. We categorize them broadly, and we categorize them into medical, surgical, and then psychological and social well-being. So these four things are addressed separately. For pre-transplant evaluation, we go through a lot of checklist for medical evaluation. The psychiatrist will see them for psychological assessment, and then the transplant team includes, for a kidney, it includes a nephrologist, a transplant surgeon or a urologist, and then set of transplant coordinators. For a liver transplant, it will be hepatologist or a liver transplant surgeon along with their transplant coordinators. For heart and lung team, they have their own separate physicians, that is cardiologist, transplant pulmonologist, and the transplant surgeon who does the heart and lung transplant. So once all these respective teams are set in place, person going through for a transplant who is receiving the organ goes through extensive heart evaluation, cardiac evaluation, which may include very advanced testing up to coronary angiography, and if need be, do the fix the heart, then subsequently do the transplant when they are deemed fit. So usually after transplant, they stay in the hospital for about 7 to 10 days. They get discharged. After discharge, then we keep seeing them for follow up on outpatient basis every once in 2 or 3 days, initial first 2 or 3 weeks, subsequently once a week, and then subsequently once in 2 weeks, and once a month. Once a month outpatient follow-up in for a kidney transplant recipient happens at the end of 4 to 5 months, and over a period of time, once they settle down with having good graft, we call this as organ which is transplanted as grafts. Once they have good graft function, their quality of life parameters are good, then we tend to see them once a month, or in certain situations once in 2 or 3 months also. Yeah.
So before we go on busting myths, I want to ask you the impact on the donor's life and the recipient's life. Like, what's the impact on both of the lives? Because as we've cleared up the what's organ donation and the general Q&A about it, now let's just go with impacts before we bust some myths.
Good. So our aim of doing this donor surgery on a person who's voluntarily willing to donate would be that his lifestyle, his or her lifestyle, will be as same as what it used to be before donation. That's the first and foremost thing. So that should happen for everybody who's going to donate. So the recipient, his lifestyle, his or her lifestyle should be as normal as what they used to be before this organ failures, but with a little bit of precautions. So this should be our goal.
So what's the precautions?
Precautions include avoiding overcrowding, take care of their lifestyle like diet, freshly cooked food, and then take medications on time, exercising, and then avoiding eating outside because of a lot of unhygienic practices. We tell them to avoid it. So other than that, these are a little bit of specific precautions, but other than that, we want them to lead as healthy a lifestyle as they used to be before having this organ failure.
Yeah, you were saying that the recipients' life should go back to normal, but then if they are unable to have the fried chicken which they desired and could not due to the transplant, so how can they enjoy that? Like, what are the medications which you use, and why can't they eat that? All
Yeah,
any other food?
I do understand. That's when I said a little bit of precautions. It's always better to have a good quality lifestyle with a little bit of precaution. That's what a transplant would give. It would give the transplant would take care of you as long as you take care of it. So, for example, a fried chicken, if I have to tell, even for a normal person, you just need to count it the number of times you eat it. You just can't keep on eating as
Yeah.
and when you
So,
eat.
what medicines do you provide for that, and why does it restrict these dietary concerns?
It's overall lifestyle, I would say.
Yeah.
Unhygienic practices, because they are on a group of medications called immunosuppressive medication. That's they are a group of medications which would suppress our own immune status because this organ is from outside. These medication allow our own body to accept that organ which is there from the outside. If we do not take these medicines, the organ which is from outside will be rejected. Therefore, we need to take this set of immunosuppressive medications. So, namely, we broadly have three medications for that. One is tacrolimus, the other one is mycophenolate, third one is steroids. So these are broadly, although we have many other medications, but these are the commoner medications nowadays that we give for any person who undergo this transplant.
So, you suppress the immune system so that the body accepts the outside organ, and you give this so that so you what do you say? You say them to avoid eating outside and freshly so that bacteria does not go in and starts infecting their body. So, as the immune system is weak, so the bacteria can't take over you. So,
Yeah, it's like you've already given medication so that the organ from outside is accepted by you. So it's a very thin line. So you have to take these medications so that the outside organ gets accepted by you. And having said that, unhygienic practices obviously
will cause
will
illness.
trigger a lot of infections in these population. That's the reason we try to always emphasize on hygienic environments and hygienic practices, I would say.
Yeah. Now let's go to busting, because these myths which are circulated in society prevents many people to donate organs because
Mhm.
of these myths. The first myth is, if I agree to donate my organs, the hospital staff would not work hard to save my life.
That's truly a myth. Uh, in fact, in fact, to operate and do something medically or surgically on a normal person has uh, much more, I would say, uh, what would I put? I don't. I'm running short of words there because that gives us more responsibility because you're operating on a normal person, isn't it? So it's a bigger responsibility, it's a larger responsibility. Not that it is any lesser responsibility a person for a person whom we operate on a person who's suffering, but Logically, this is a bigger responsibility because we are operating on a person who's essentially normal. So yeah, it's a very big myth that the medical fraternity would not take care of a person who's donating. In fact, we salute them.
So you were saying you salute them and you treat them the same way you treat a normal person. So you'll put in the same exact of hard work if the same person has some other illness which needs immediate help, med help.
I didn't get your question.
So I'm telling that you're basically saying that you salute them who have donated their organs to others and you treat them and put in the same hard work you would to a normal person if they had the same illness. No, not the same illness, but came in and they had a heart attack or something like that.
Yes,
You
yes.
try to save them the same way you have saved a normal person.
Oh yes, I mean, this is after donation you are asking me?
Yeah.
After donation? Yeah, after donation, like we discussed earlier, person's donation would have had happened long time back. Then if they have gotten some illness post donation, which is completely other than because of this donation, then it will be handled like what is generally needs to be done. Yeah.
Yeah. The second myth is I'm too young or too old to donate. Is there any age restrictions instead of becoming a after becoming a major? Can
Yes.
you donate after like 60 years of your life?
Yeah, living donation is very well defined as per the law of land. Any consenting adult, any person who comes as an adult can donate. That's the
Is there any
minimum.
age limit though? Like
Upper limit? Upper limit?
yeah, like 18 years to or
Yes, 21.
18.
21, lesser than 21 years, they cannot donate in India.
You need to be 21 years
Yeah,
old.
21 and above.
Okay, so is there any upper age limit like 21 to 60 years old or they
Yeah,
can donate
upper,
at a very
upper
young-
limit generally we go up to 60, 65 also.
But is there laws for that or
No. The upper limit there is no law, but they have to be consenting. They have to be in their own senses. Their IQ level should be all right, and they should be in a situation to consent. They should be able to understand what they are doing. So that's where the psychiatry assessment comes in picture.
So the psychiatric thing will help them understand and all in that.
Yes, yes. They assess their scale and then and their intention of doing it, and yeah.
Only a heart and only a heart, kidney, liver can be donated or transplanted.
Like we had already discussed, any organ can be taken for transplantation in a deceased donation. But in living donation, one kidney can be taken and a part of liver can be taken. Yeah.
Okay, now let's deep dive in your specialization. Okay, first question for that. Can you describe the specific surgical techniques used for kidney transplant and how those procedures have evolved over time?
So there are, we need to separately handle this donor surgery and the recipient surgery. Donor means person who's giving, recipient means a person who's taking it. The donor surgery, I will be specifically talking about kidney donation, in fact. So earlier we used to have what is called as a open surgical technique. That means a large cut would be done and then dissected extensively all the tissues, and then one kidney would be harvested from the donor, which would include artery, a vein, and harvesting the urine tube that's called as ureter. And then once we get that kidney out, then we use special solutions for the kidneys to be primed so that the core temperature of the kidney is reduced so that we have longer time to do this surgery onto the person who is receiving, so that the kidneys would not be injured during the harvesting and while transplanting. So over a period of time, the donor kidneys or donor nephrectomies have evolved from open surgical techniques to laparoscopic technique, and now we are also doing more and more robotic techniques also. It's a choice of people who want to undergo this surgery. So depending on many advantages and disadvantages, the surgical team will decide which is good for a particular person. So that is what happens for the donor. Nowadays, for the recipient also, quite most of the surgeries are open surgical techniques where the artery is joined to one artery of the recipient, the vein is joined to another vein of the recipient, and the urinary tube is connected to the urine bladder of the person who receives it. Nowadays, few of the centers have slowly started doing robotic recipient surgeries also.
Yeah. Now, moving on, what are the common long-term side effects of immunosuppressants medication after the transplant?
Yeah. So we categorize them into short-term, medium-term, and long-term. In the short term, because the dose of immunosuppressive medications are very high, they are more prone for infection. Infection could be either viral infection, bacterial infection, or a fungal infection. But in the long term, we see metabolic concerns, especially with the steroids, where they will have predisposition to developing diabetes, or the blood glucose control will be haywire, and then developing muscle weakness, cataracts for that matter, and then putting on more weight after the surgery because of these medications, and then excessive hair growth or excessive hair fall may happen, and I think broadly these are quite a few common side effects.
What are the current research in kidney transplants, such as animal to human or regenerative tissues?
Oh yeah, excellent question. In fact, animal to human kidney transplants are called as xenotransplantation. We have had a very big step forward in the US of late, where a pig's kidney was transplanted into a person after genetically modifying it, so that the human accepts a pig kidney. So we need to genetically modify their tissues and then do the transplant. We still have more progress to be done in that, but we have come a long way. Hopefully that addresses our organ shortages. The regenerative medicine also utilizes very similar principles, where a small tissue is taken, artificially grown in the lab, and which is made deemed enough and fit to be transplanted. Not only is the transplant used in regenerative medicine, but these tissues or tissue cells, columns are being utilized in these dialyzer tubings, where apparently more closer original kidney functions happen in these dialyzer tubings. So that is where regenerative medicine is progressing towards.
So, before we conclude, just one last question. What do you think would be the role of society to increase the organ donation number, like number of donors increase? What is the role of the society here?
Yeah. So it's a very multi-pronged question, which is actually very, very important because um, it has to be done from a very basic ground level. So it has to be started from the schools, the awareness. It has to be trained at community level, at places where people practice their faith, their religion, and in the communities where they live. And we should include print media, social media, and then uh, radios, televisions, and then always we should give positive aspects about donations, and we always have to emphasize on the need for donations, because so much of discrepancy in demand and supply, because the people, there is a lot of demand but the supply is very less, because of many reasons again. So population at large, we should always highlight good things about a transplant rather than highlighting pitfalls which we see. There are failures, of course, in transplants. It's not that every single transplant is going to be successful, but then compared to a person being on dialysis, transplant offers them great quality of life, and we should always highlight good things about a particular aspect, let it be in real life or let it be transplant. So the more we highlight about goodness, the more we get good things out of it. Hope that answers your
Yeah.
question.
Thank you, doctor, for your time.
Thanks,
Really
Zain.
appreciate
It was
it.
nice interacting with you, even though it was a very short notice, but it was really, really good. I wish you all the very best in all the endeavors that you want to succeed. Okay? Wish you all the very best.
Thank you.